Welcome to the FOCIS podcast, brought to you by the FOCIS Communications Committee.
Well, hello, Dr. Albani. Thank you so much for being here today. Why don't you go ahead and start off with an introduction?
Hello, and thank you for having me here. My name is Salvatore Albani. I'm currently professor of medicine at the Duke-NUS Medical School in Singapore, and I'm the one who started and is directing the Translational Immunology Institute there. Very briefly, what I do is more than just a job, it is a passion and is a mission, and is to understand human immunology based on unmet medical needs and scientific curiosity, and hopefully translate this knowledge into something useful to the people. I really think that our duty is to evolve from selfishness of impact factor and move toward impact for society. As a matter of fact, my dream would be at least one of my inventions would go to the people.
All right. Well, thank you so much for being here. So what would you say is new that's going to be coming new on the horizon for immunology? Where do you see it going?
I think we live in an exceptional period, a period where the evolution of technology has opened the horizons which we do not dream of. One of the most interesting things is the convergence of the use of big data into our practice and the revolution which this has determined. In essence, what were algorithms which were used by Google, Amazon, and the like to check if somebody would buy Prada or Ferragamo, now are used, of course, with the proper tweaking, to predict clinical fate, to inform our therapeutic and diagnostic decisions, and to stratify patients more on what they are and less on what they look like. Immunology plays a fundamental role into that, because the immune system contributes directly to certain diseases and indirectly to a lot more, and understanding how it works at high dimensionality, so using big data, and then applying molecular approaches which zero in the target, which can be then affected by novel therapies, is the future.
Well, that sounds very exciting. So how would you say this will impact FOCIS in the future?
I would reverse the question, if I may. How can FOCIS impact this? I think that it is just my personal opinion, doesn't reflect anyone else, or rather the organization either. I think that FOCIS is in a very important position. It has the opportunity to catalyze evolution of translational immunology from a somewhat selfishly isolated field to something which is truly impactful for society, and therefore to attract other sectors of society to inform, but also to translate, to make the discoveries we use truly useful to the patients.
Well, thank you so much. It was so great to have you here today.
Likewise, thank you for having me.
And now we will hear from Dr. Piccirillo, who is a part of the FOCIS FCE committee.
Well, hello, Dr. Piccirillo. Thank you so much for being here.
Thank you very much.
Why don't you go ahead and tell us a little bit about yourself?
Well, I'm a professor at the Department of Microbiology and Immunology of McGill University in Montreal, Canada. I'm also senior scientist and director of the Infectious Diseases and Immunity and Global Health Program of the Research Institute at McGill University Health Center, which is essentially a large department of clinicians and fundamental scientists who work in the area of infection and immunity.
Great. Well, thank you so much for being here.
Pleasure mine.
So what would you say, what research have you conducted that you're most proud of?
I mean, all the research that we do, we're very proud of because it really engages trainees at different stages of development. But over the course of my career, I've been very focused and interested in understanding the mechanisms that dictate whether an immune response is controlled or regulates an immune response. And for the past 20 years, I've been very specialized in understanding the function of a unique type of white blood cell, a lymphocyte, a regulatory lymphocyte, akin to a fireman in our society. It turns off immune responses. And it is thought that these cells are defective, either in number or in function in many autoimmune diseases. So we have focused for the past several years in understanding what determines their birth, how are they developed, what is their lifestyle, what's their habitat, how do they work, and what goes wrong in disease. And more importantly, is there any way of switching them back into operation, turning them back on in the context of diseases like autoimmunity?
That sounds very exciting.
Yeah.
So then moving on, if your colleague asked you why they should join FOCIS, what would you tell them?
I mean, FOCIS, I've been involved since the very beginning of my career. It's an extraordinary association to be part of, simply because it is capable of bridging the fundamental scientists and the clinical scientists, understanding the underlying biological problems, some of the more important diseases of the Western world, whether they deal with autoimmunity or infectious disease or transplantation or allergic responses. And as a result of that, it really allows us to bridge that gap between the bench and the bedside. That is a major strength of FOCIS. I think it's one of the leaders of its time. It's one of the leaders of all research associations, because it achieves that in bridging that gap so successfully. It's had a major impact in my career as an investigator, because it brought me very close to some of the leading minds of this world, but from the perspective of mentorship. These individuals have been remarkable in terms of providing me with timely advice in terms of grant writing, fellowships, running a lab, which is not very simple, and career development. And I would say that because of the mentorship that a lot of these people have had, Gary Fathman, Abul Abbas, just to name two of the very many, it really has allowed me to make the right decisions in terms of my career. And I think that a lot of the responsibilities that I occupy for my institution today, the leadership role of my research program internationally, the quality of interns that we're capable of recruiting, training, and putting out into the world, and the large body of research that we're capable of generating, I would like to say the FOCIS played an important role in helping me consolidate my research program from the very beginning of my career. So for that, I am grateful. And as a result, I actually think that it's a fantastic stepstone for any new investigator emerging from their postdoctoral training, undertaking their first few steps into independent academic research life. I think FOCIS is an extraordinary mentoring guide.
Well, thank you so much for that. And then to wrap up our interview today, what are you most excited about when it comes to the future of autoimmune research?
I would say autoimmunity, there are many elements that are particularly exciting. I think understanding the underlying triggers of that disease from the environmental perspective, the capacity of viruses and viral infections of tipping the balance and promoting the onset or progression of an autoimmune response. That's very exciting. The capacity to detect, pinpoint the deficiencies of the immune system that leads to the onset of that autoimmunity is particularly exciting. The very large spectrum and diversity of therapeutic approaches that scientists here and beyond have developed to restore the balance of the autoimmune response, either preventing it from starting, attenuating, or blocking its consequences, is particularly exciting. I think of our own work in my independent laboratory, where, for example, we can take hematopoietic stem cells from cord blood or peripheral blood of a normal individual, and in vitro, we can recreate the thymus tissue of a human. And those stem cells can undergo a very complicated developmental program where they develop into human lymphocytes, human T cells, and human regulatory cells. Those cells now, derived from those stem cells, can now be retransferred into an individual who's born with mutations, for example, that prevents them from developing their own regulatory cells. This sort of avant-garde, innovative, high impact type work is something that I'm particularly excited about. It's something that makes me lose sleep on in a good way. And it really provides, I think, a very conducive environment for trainees to learn multiple aspects of modern immunology.
Right, that sounds very exciting. Thank you so much for taking the time to talk with me
And
today.
thank you for the opportunity.